I'm Dr. Justin Paul. I'm an orthopedic spine surgeon working with Ortho Connecticut. And I want to talk to you today about what to do for a herniated disc in your neck. And I want to talk to you specifically about a disc replacement. Okay? So a lot of times people have pain in their neck. And usually you can treat it with some therapy, some anti-inflammatories, and it goes away. Sometimes there are some unfortunate folks who have the problem last so long and it's so severe that it even shoots down into their arm and in their fingertips. In the worst of cases, people will be dropping things and not even able to function with their arms. And it all comes from a problem that's in your neck. What happens is this cushion in between the bones here squeezes out the back and pinches this nerve. Okay, this nerve is the yellow thing and it goes all the way into your hands. So when that nerve gets pinched long enough or is problematic enough, oftentimes someone like myself will recommend a surgery to fix the problem. That surgery means we have to take that disc out. In doing so, we relieve the pressure on the nerve, and that's the most important part of the operation. But we can't just leave it like that. We have to put something back to hold its place. So what we do is we put in a little wedge. Now that wedge used to be a piece of bone. In fact, we used to take bone from your hip, but most surgeons don't do that anymore. Nowadays, we put a wedge of bone, or we put even a titanium wedge. But the newest kid on the block is something that matches the motion of your spine. That's called a disc replacement. And it's a small biomechanical device that works just like your neck works, because your neck is not just a moment in time. If you look at these x-rays, this is the neck in one place when you're bending your head that way. And then when you bend your neck forward, you see the difference in the curvature? All those little discs allow you to have motion. And it's best, I think, to preserve that motion and make your body the same way that it was before you had the problem. So putting in a disc replacement takes a certain skill set, because you have to match the quality of the bone, you have to match the biomechanics of the spine pretty much perfectly so that it has long durability. If you're having a problem in the neck and someone has suggested surgery, you might be a candidate for a disc replacement rather than a fusion. So please, come and talk to us if that's your case, or if you know someone who that's the case.